So under 5 minutes, I want us to do upper and lower motor neuron lesions. So an upper motor neuron spans from the cerebral cortex or the motor cortex to the anterior horn cell. Now these utilize corticospinal pathways which transmit motor signals from the cerebral cortex to the spinal motor neurons in order to control voluntary movements. Now, lower motor neurons carry signals from the spinal cord or brainstem directly to the muscles themselves to produce voluntary movements. Now, sometimes you can have lesions or injuries happening in these neurons. So, what happens when there's a lesion within the lower motor neuron, within the lower motor neurons and upper motor neurons? So, we're going to look at those differences, and you really need to pay attention to this, because definitely under this topic you're going to find either MCQs or you're going to meet this question in form of an image, maybe under your or during OSCs. Okay, so we're going to look at these features one by one and see their differences, okay, in upper and lower motor neuron lesions. So in upper motor neuron lesions, muscle tone is increased, so you have hypertonia. Okay, you have disuse or mild atrophy. Now some literature here will tell you to say there's no atrophy. Okay, so there's hyperreflexia or increased reflexes and a positive Babinski sign. Now, what is a positive Babinski sign? So a positive Babinski sign, it's seen when there's a lesion in the corticospinal tract. All right, so this is abnormal in adults and normal in children, especially below 2 years. So in adults, how you test for a Babinski sign is you firmly stroke the sole of the foot rather, from the heel to the toes, and then you observe the response of the big toe. So under normal circumstances, the big toe has to flex downwards, okay, or plantar flexion. That is normal. But a Babinski sign is positive when this big toe dorsiflexes. All right. In children, it is normal. When you see this feature or this sign, you don't have to worry, because it's normal in them due to an incomplete myelination of the corticospinal tracts. But because in adults myelination is complete, you don't expect the Babinski sign to be positive. Now, the other thing that you find in upper motor neuron lesions is absent fasciculations, and you also see spastic paralysis and a present clonus sign. Now, things like clonus and Babinski sign, they are usually well appreciated when you see them, when you see one. So take time and look up one. Lower motor neuron lesions is basically the opposite of everything that we did here under upper motor neuron lesions. So you see decreased muscle tone, severe atrophy. Remember here we said mild to no atrophy, but here there's severe atrophy. Okay, there's hyporeflexia or decreased reflexes, a negative Babinski sign. Okay, positive fasciculations or muscle twitchings. The type of weakness that you see, you have to know this difference again. I forgot to emphasize. In upper motor neuron lesions, you see spastic paralysis, while in lower motor neuron lesions, you see flaccid paralysis. And remember, there's no clonus in lower motor neuron lesions.